What's going on, everyone? Welcome back to the Rehab Science Podcast. Super pumped about today's episode. I've got my friend and fellow content creator, practitioner, Brendon Talbot, an osteopath out of Toronto, Canada. Like I said, super excited to have Brendon on. I have not had an osteopath on the channel, and there's a ton I'd like to learn about osteopathy and how Brendon approaches patients. So super excited for this episode. Brendon, thanks for coming on.
Yeah, thanks for having me. I appreciate it. Nice
Heck
to know
yeah.
I'm the first osteo on here.
Yeah, no, yeah, sweet man. I've had a. It's funny, yeah. I've never osteopathic medicine is different in the U.S. I think
hmm
than
It
other
is.
places. Like you have to get your
We treat very
DO.
different than a
Y-
DO.
Totally.
Yeah,
Yeah, I feel like
we'll dive into that a little bit too.
I feel like all the DOs I interact with are more, they're more like they function more like an MD. They're a little more they have less to do with the musculoskeletal system, even though they might
hmm
learn some of that. That's just not usually their specialty area. They end up doing a residency and going some other direction. So there is one osteopath actually in my town here in California who does only treat musculoskeletal issues and is mostly kind of a manual therapy based practitioner, but he's pretty rare. Like I don't meet many other osteopaths like that. When I was in one of my final clinical affiliations when I was in physical therapy school was at a physical therapy clinic where they had a very strong osteopathic emphasis. And so I remember for that affiliation, I had to actually watch a bunch of osteopathic treatment techniques before I could start the internship. And I can't remember the guy's name, but he was a
Interesting.
anyway, so it was interesting. I was watching some of your videos and looking at some of your assessments, and of course, they look very similar to my manual physical therapy kind of assessment, but it reminded me of that affiliation. So, but dude, just as we get into things, can you tell us a little bit about your background? Before college, like what you studied in college, a little bit about your osteopathic program. Just give us some insights.
Yeah, totally. So I grew up and sports was kind of the main thing in my life. I was fortunate enough to have parents that supported sports and gave me the opportunity to try whatever sports I wanted. So my first sport that I played was baseball, and then I moved into soccer, and my winter sport was hockey. So hockey kind of lasted almost my entire life, and then my summer sport would change. So I played baseball, then soccer, and both were at relatively a high level, like almost the highest level as you can play. And then I moved into lacrosse. So then I played box lacrosse and field lacrosse. Box lacrosse is a little bit more popular in Canada, where I know field lacrosse is a lot more popular in the States.
Yeah.
Um, so I played the highest level of lacrosse, played double A hockey, triple A would have been the highest here. And then moving into high school, I started to experiment with other sports. So I was on the volleyball team, the cross country team, the track team, and then I picked up pole vaulting, which was pretty cool.
You did everything.
Yeah, and it kind of all ties into what I'm doing now, which is pretty
Yeah.
awesome. But I got into pole vaulting, luckily, just my school offered it. I didn't even know what it was. They're like,
Hmm.
"Would you like to try it?" Sure, no problem. I kind of fell in love with it pretty quickly. Fast forward to the end of high school. So in terms of what I enjoyed subject-wise,
Yeah.
to be honest, in high school, I really disliked science.
Mm.
So I was like more into math. I liked math. I liked the computer stuff. I liked gym. Those were kind of what I enjoyed. English, I didn't like. History, I didn't like. Science, I didn't like. But learning science in a different way kind of gave me that passion. But in high
Mm.
school, it was just a little overwhelming. Like they would say a sentence, I didn't even know what any of the words in the sentence meant. So I was very confused and lost. And chemistry, physics, and bio, I didn't really like any of them.
Yeah.
So then pole vaulting actually started to take off. I hired a track coach outside of school, and I actually started to do really well. I ended up staying back in high school for an extra year to try to get a scholarship in with pole vaulting.
Yeah.
So my fifth year of high school, I basically just took a light course load and I was just there strictly to focus on track and field.
Wow.
And it was awesome. Like the teachers were great. They would drive me to practice. Like they accommodated my needs. If I needed a different pole for a competition, they would buy it. So I was very fortunate in that sense. That year, I ended up winning OFSA, which is like the state championship,
Yeah.
I guess you can say. So I won gold at that, which was basically my whole intention of staying back.
Yeah.
So that was pretty
Pretty
amazing.
epic. Yeah.
That landed me a couple opportunities scholarship wise in Canada. I ended up taking one of them to Windsor. So it's another city in Ontario. They had the best track and field team in Canada at the time, so I figured that that would be a good place to go. I did pole vaulting in university, so I had to quit hockey. I had to make the decision to take a hockey scholarship. Do you know the school called Mercyhurst in Pennsylvania?
No, I don't think so.
Okay, it's a smaller school. They
Yeah.
offered me a hockey scholarship, but the school was like a really small school, very similar to my high school, and I
Oh,
kind of pictured if I was going to the States to go to one of these like big
big school.
grand
Yeah,
school, right? So
totally.
I didn't end up taking that. So I took the track scholarship. I
Yeah.
did track for another 3 years. But in my last year of high school, I ended up taking kinesiology.
Uh-huh.
And kinesiology, I really enjoyed. I was like, okay, this makes a lot of sense. It's more movement based, it's more practical. I really like that. I like the anatomy aspect, even though anatomy was like the most confusing subject.
Yeah.
So then
To-
I was like, okay, I can probably see myself getting into something like this. So I ended up taking kinesiology in university. So that's how I ended up getting into that. I took kin in year one, year two, year three, and then in my fourth year, I did an exchange program in the UK.
Uh-huh.
So I got to take kinesiology in the UK, which was really cool because they are a lot more research based kind of
Gotcha.
out in Europe. Whereas
Yeah.
like we were more like
Kind of
study, memorize,
application.
test,
Oh, got it. Got it. Yeah,
not
yeah.
even
Just
application in
just
university. It was like
academic
just,
kind of.
yeah, just very academic. So it was really nice to get that experience in the UK of a lot more lab work. They would kind of give us, 3 topics per class and say, you have 2 months to learn as much as you can on this topic and you're going to teach the class, which was really cool because it gets you to dive a little bit deeper into a topic. And then you're teaching the class, but you're also being taught by other groups their topic.
Hmm.
So you kind of get like a really good foundation for whatever topic it is they're talking about.
Yeah.
So that was a really cool experience. The lab work was really cool. We got to like check people's body fat in like different ways, like using the bod pod and the underwater weighing
Yeah.
and like all these different techniques, which was really cool. So I
How long were you
enjoyed
there
that.
for? Was that
Just
like a
just 1 year.
you were there for the whole year though, your whole senior
Yeah, I
year?
did both semesters.
That's
I figured
epic.
like if I'm doing an exchange, like one semester is only 3.5 months.
Yeah.
Like it's
Yeah. Take
quick.
advantage of being there.
Yeah, except I'm like, oh, England, everyone speaks English. Like it's not going to be a transition. After like the second month, I'm like, whoa, like it's very different here. And I kind of got a
Uh,
little homesick
oh
and I was
yeah. There's
stuck
the
there for 8 months.
yeah. Yeah. Kind of like the culture shock. Like I could
It
see
was,
that.
it was,
Yeah.
yeah. And I just expected it to be the same. It's kind of like
Hmm.
Canada and the US, like different parts are very different.
For sure.
So I was like, well, I'm stuck here for 8 months. I just got to figure out a way to cope. And
Yeah.
then by like month four, I was like really enjoying it and
Nice.
didn't really want to leave after that.
Yeah.
So that gave me the opportunity to travel to a lot of countries. Traveling from England was like relatively cheap. Good old Ryanair.
Yeah. Had you
So
traveled much like growing up, or was that kind of your first big travel experience?
a little bit for sport. I would say
Yeah. Oh
like
yeah.
mostly to the States, like Michigan, Ohio,
Yeah.
Pennsylvania. That's kind of it. I went to Florida a few times with my parents, went on a cruise when I was in grade six, but besides that, like not too much travel. So I
Mm-hmm.
really tried to take advantage when I was in the UK.
Yeah.
And the way my schooling was set out was pretty nice. Like I had Fridays off. I finished Thursday at 1 p.m. and I didn't have class until Monday at 6 p.m.
Oh,
So
booyah.
like every week I kind of had a long weekend, which gave me a good opportunity to travel.
Yeah.
So that kind of really pushed my passion in the body, I guess you can say, and like understanding the body, understanding performance, understanding, how to maximize different things with the body, whether that's strength, endurance, knowledge. I just started to become more curious. I came back. I had to actually do another semester in university because they didn't let me graduate while I was on exchange. So they made me do
Oh,
an extra term and then graduate here. So I did 4.5 years of school there. So I ended up having a lot of years of school because after
yeah.
that is when I decided to go into osteopathy, which
Mm-hmm.
was another 4 year program
Oh, it is. It's
on top
four.
of that.
Wow.
Yeah, it was 4 years. So
Yeah. So five for high school, four and a
four and a
half
half
in
and then four.
undergrad, and then another four. Yeah. It's a lot.
Yeah,
Yeah. It
no time
adds
off
up.
either.
Uh-huh.
Yeah, it was a lot. Uh, Actually, like initially, I wanted to be a chiropractor. So I didn't know about osteopathy when I was in university. We weren't taught about it. It was either like physical therapy or chiropractic. That
Chiropractic.
was
Yeah.
kind of what I was going to get into. And then my mom was at a party in the time that I was looking for a school to go to, and she met a lady whose son was in school for osteopathy and kind of talked to her about it and gave me a call and said, "Why don't you look into osteopathy? Like it seems pretty interesting and a little bit similar." So the more research I did, the more I was like, this kind of makes a little bit more sense. It's very similar, but it's more integrated with different systems of the body. And I'm like, okay, well, if you're treating a body, it kind of makes sense to understand more of it.
Sure.
So I just honestly went to the school for a visit day, got a really good feeling about it, and I was like, all right, I'm sold. So
Yeah. Wow.
I gave that a try.
Yeah.
And then 4 years of osteo school.
What do the
Uh,
initials mean? I saw what does that stand for?
so
Your
in Ontario, or like that designation means Master of Osteopathic, uh, MO, Master of Osteopathic Manual Sciences
manual
or
sciences. Oh, okay.
Manipulative Sciences,
Manipulative sciences. Yeah.
either
And it's
or,
a
manual or
master's, but
manipulative.
it's 4 years.
Yeah. So it's the same, like in terms of how we were taught anatomy, physiology, biomechanics, like very similar to med school, but
Yeah.
we had a lot more, like obviously hands-on, like the
Sure.
majority of our work was hands-on, where we didn't have to learn about pharmaceuticals, medications,
Uh-huh.
that kind of stuff. So I think in terms of like how we differ from the medical program is we don't spend a lot of time, like, let's say, talking about disease per se. Like we have to understand how disease becomes disease and
Mm-hmm.
what systems and processes are involved and how that comes about. But we didn't focus too much on like, the symptoms of each disease and like what kind of medication to give it because we don't treat that way.
Yeah,
We
it's not an
try to
intervention. Yeah.
understand, okay, this is the disease. These are the types of things that have to happen for that disease to happen. Okay, what things are going wrong in the body that's leading to that, and how can we kind of work with that body to slowly either slow down the progression, reverse the progression, or you know manage the progression. Because
Mm-hmm.
sometimes, if a disease is progressively getting worse, if you can slow that down or put it on pause, like that's still a huge improvement.
Yeah.
You might not cure it. Like there's certain things that you can't really cure.
Sure.
Once they've gotten so bad, but you can like prevent a lot of it and slow it down.
Yeah. So in terms of patients who come to see you, is it mostly musculoskeletal symptoms like pain and injuries, or do you have people come in that are having, might come to you for I'm not sleeping well, or I have a digestive issue, or
All
other
across the
systemic?
board.
It is. It's
Yeah,
all
yeah,
across. Yeah.
completely. Because
Huh.
because a lot of those, like there's always a cause for it. Um, like non-normal symptoms, something is causing it.
Mm-hmm.
Unless it's something that we should all experience, like a menstrual cycle, like that's not a lesion because that's
Mm-hmm.
normal. But
Mm-hmm.
when there's things that are abnormal, something is leading to that. So like as an osteopath, the whole idea of it is trying to get a complete picture of what's going on with this patient
Mm-hmm.
and how can you approach them. So like I'll give you an example. Like let's say someone comes in with a lot of sympathetic, like heightened sympathetic nervous system stuff. So digestive issues, can't sleep, um, thyroid issues, adrenal fatigue, like all of these things that are going on. And like you start to paint the picture. They explain what's going on. You're like, okay, well, right off the bat, we already know that there's heightened sympathetic nervous system tone. So right away, what are some of the things that I'm going to do to help lower that sympathetic nervous system tone? So in my treatment, my tone of voice, my pace, like that's all going to kind of play a role because if I'm talking very fast and talking like this, like that's just going to kind of heighten
Mm-hmm.
their
Ramp it up more. Yeah.
yeah. So like there's those little details. And
Mm-hmm.
then in the treatment's going to be very relaxing. It's going to be inhibitory. So I'm not going to really go like direct into like lesion patterns. So like
Mm.
if a hip doesn't want to internally rotate, I'm not going to really force internal rotation because that's also like a stressor to the joint. I would actually kind of work through external rotation to like the point as to which I feel things start to let go. And then I might introduce slowly into some internal rotation, but in a way that the body's not perceiving it as like a threat or a negative kind of response. Targeting parasympathetic areas of the body, so like sacral cranial treatment, like increasing the parasympathetic tone so that the sympathetic can kind of relax. Looking for any lesion patterns through like the dorsal, like through the thoracic spine, because the sympathetic chain sits right in front. So if you have like extended thoracic spine, putting a lot of pressure on those sympathetic ganglia, that's going to increase sympathetic tone. So like there's a lot of things that my head is already kind of going
Yeah. Think.
through
Yeah.
before I even put my hands on the patient. And I'm just
Hmm.
trying to get an idea. So it's really about understanding how the body works and understanding
Yeah.
what that person is going through.
Mm-hmm.
So I think it's, like we treat the musculoskeletal system, but we do it in a
Yeah.
way that we can influence other things
That's so
like the
cool.
lymphatic system and immune
Yeah.
system and stuff like that.
It's so cool to hear other people's kind of like the principles and foundational elements that underpin kind of their profession, and just how, like, you and I, like I said, I'll look at videos of what you're doing and it's like, okay, this techniques can look similar, but what you're
Hmm.
thinking about going into that, and even we just think about it in a lot of ways that are the same, but also different. Like when you're talking about, like, well, what threat is this introducing to the nervous system? Like I'm talking about that all the time with pain science and pain neuroscience. Like thinking about, okay, well, the brain perceives, the nervous system perceives there's some threat here, and that's why it's outputting pain. But you diving into thinking about, well, I don't want to push if this person's has a lot of sympathetic activity, sympathetic nervous system activity. I want to push right into something that's even more threatening and might ramp that system up. That's like just I've never heard anybody talk about that, of like thinking about, like, there's a lot of talk these days about parasympathetic and sympathetic, but I haven't heard someone talk about it from a manual therapy standpoint,
Hmm.
like of how it directs your manual therapy kind of
Totally.
process.
Even like, so how we were taught in our school was principle based, not
Mm,
technique based.
yeah.
And what's amazing about this is like, okay, they use this example in school, so I'll just kind of use this example. Let's say someone comes in with left shoulder pain,
Hmm.
but let's say they're missing an arm.
Hmm.
How do you treat that shoulder if you're only taught certain techniques using the arm? You,
For
you don't
sure.
have any like logical kind of approach. Now you're stunned. You're like, okay, shoot. Or like, let's say someone has low back pain and they come in a wheelchair.
Hmm.
How do you treat their low back?
Yeah.
So there's different connections in the body that you can use. So like with the shoulder, for example, you can use like a cross extensor reflex. So like you can treat the other shoulder to influence that shoulder, or you can treat the neck to influence the shoulder, or
Yep.
you can work on the upper ribs or the clavicle or the scapula to influence the shoulder. Like there's
Hmm.
other means that you can use, or maybe due to that shoulder dysfunction, let's say they're able to walk, that's going to influence their gait cycle. So now you might look at the pelvis or the knees or the ankles and notice like a really awkward pattern because that's how their body's compensated to what's going on with the lack of swing from the shoulder. So you
Hmm.
have to you have to address those things to really kind of have an influence on the shoulder too. So
Yeah.
it's a lot of like looking to one area but also looking somewhere else, and then how does that connect? And then okay, well that's connecting this way. Okay, but how is that affecting this? And and then you try to get an idea too of like what people are doing in their life. Like, are they spending majority of the time sitting? Well, then if someone comes in and they're having like venous issues, for example, like where their uh, like venous system is lacking pumping, and they're having a hard time getting that fluid back to the heart.
Hmm.
And then you find out that like they're not really moving much in a day, and like that might seem super obvious, but people don't know that movement is the only thing that pushes blood back to the heart. So
Yeah.
they're thinking, well, why do I have these varicose veins, or why do I have all this swelling in my leg and it's not going away? It's been there for 6 months, but there's nothing pushing that fluid out. So fluid is constantly coming down, especially through gravity, but there's nothing bringing that blood back. And
Yep.
there's a lot of different things you can, even talk about with that. It's like restriction through the diaphragm. If you have a rib cage that doesn't move very well and you're wondering why the legs aren't draining, well, it could be backing up kind of like through the diaphragm, and just like traffic on a highway, like if the accident is 5 kilometers away, it doesn't matter. It's going to back everything up like along that pathway.
Hmm.
So it's like important to kind of look through those
Yeah.
things too. So it's interesting.
Yeah, no, it's so cool. I think there's so many elements. I think you're exactly right. Like, it doesn't make a lot of sense to just learn these isolated techniques. You need to know, you kind of need to have this, you need to have this understanding of, biomechanics and neurophysiology and how, and be thinking about the whole system and how it's all interconnected. And I think I see this talk in the US a lot in terms of physical therapy, of looking, especially from a biomechanics and a kind of a nervous system standpoint, of like, okay, thinking about the kinetic chain, like you're talking about the person, like, what if they didn't have an arm? Like, what are the other adjacent joint systems, joint complexes that would influence the shoulder joint, like you're saying, like the ribs, the scapula. From a neuroscience, the neurological side, we could look at the neck and the nerve roots that would innervate that area, and then the neuroscience side would talk about, like, well, all of this is ultimately coming from the brain. So, what
Well,
can
that
we
too.
do? Yeah.
And even like when you start talking about pain, something that a lot of people tend to forget is like our nerves are living tissue.
Mm-hmm.
They like like the signaling in the nervous system can also be affected. Like if you have chronic pain,
Yes.
there's a pathway from the site of pain that someone's feeling to the brain, and then there's a pathway from the brain back out, right?
Mm-hmm.
And like that pathway also works as an inhibitory pathway. So like if the signal's coming in, there's an inhibitory pathway that basically the brain's like, okay, well, there's no more damage,
Mm-hmm.
there. So
Yep.
we can kind of inhibit that pain response out. But if you have chronic pain, that inhibitory pathway can actually like there could be an override where
Mm-hmm.
that inhibitory pathway stops functioning correctly. So now you get this reflex of pain when there's no issue.
Mm-hmm.
So
Yep.
pain is a very complex topic because one, it's subjective.
Mm-hmm.
So the patient comes in and they're experiencing pain, but pain is subjective. So like as an osteopath, we don't really use pain as like a lot like a very
It's not
important
guiding your,
factor.
yeah,
It's not
yeah.
guiding the treatment.
You're thinking about
It
other,
tells
yeah,
me like what they're experiencing,
sure.
and I listen to it, and I'm like, okay, obviously your brain is perceiving this,
Yep.
whether there's an issue or not. It doesn't really matter if there
Yep.
is or there isn't. They're experiencing it. They're not coming in here and making things up. Besides, I had one buddy that kind of tricked me. He lied when I first graduated, saying he had pain in his shoulder, and
You're
I
just
assess
making it up.
everything, and I'm like,
Yeah.
there's no issue.
Yeah.
He's like, I was just seeing
Oh,
if
you
you
got me. You caught me.
and I'm like, I'm like, okay. But for the most part, people come in and, like they're experiencing something.
I love that
And
you're
what,
saying that. I just want to, like the fact that you're validating people, because I think that we talk about it in the research is so important with pain, because sometimes people hear us talking about, how the nervous system contributes to pain, how the brain does, and sometimes they'll think that we're saying, oh, you're making it up and it's in your head. So I just love that you're right off the bat saying, I know it's real. Like it's a subjective experience, but we know you are experiencing it. It's a real thing.
and the main principle of osteopathy, so like the founder of osteopathy, Dr. Andrew Taylor Still, he was like early 1900s. He was a physician for 40 years, but he just questioned, or 30 years, but he just questioned the medical system as to like why does when someone come in with a symptom, you just give them a medication, but you
Mm-hmm.
don't really try to figure out why it's like, so like let's say headaches, for example. You
Yeah.
give them some sort of medication, tell them to come back in a week. Okay, did the medication work? Yes. I'm going to give you more of it. No,
Mm-hmm.
I'm going to give you a different one. It's kind of just like a shotgun approach based on what's common. But what
Mm-hmm.
he realized is when someone has a headache, something is causing that headache, whether it's lack of blood flow to the brain or lack of drainage out, so there's too much pressure up there, or whether there's tension coming from somewhere in the body, whether it's like a tension headache, or are the sinuses congested? Well, that also could be a drainage issue. Are the lymphatics backed up? Something is causing that headache. And it could
Yep.
be any of those, because a headache is just a general term for any pain in the head. But
Mm-hmm.
there's a lot of stuff in here, right?
Yeah.
Like
Yeah.
the
Yeah.
brain is getting blood. Even just we know that thinking accesses different parts of the brain. So if you're thinking about something specific and that part of the brain's not getting enough blood flow, that can create a headache. Like it's so detailed, but you're just giving them a medication
Just
and
treating a symptom. Yeah.
not
It's
even
like you're
trying to
just,
figure out what's causing it.
yeah.
So, people are always like blown away when they're like, I've had headaches for 30 years. And then you find, dysfunction through the cervicals, C1 and
Yep.
C2 are completely lesioned. You make those move better in the ways that they're supposed to move. And now all of a sudden, everything can kind of flow normally again.
Mm-hmm.
But
So is that kind
it's
of what Dr. Still, you were saying he was a physician, like a medical physician, and then he was like, did he kind of
yeah,
hit a
his whole
point where he's
family
like,
was in the medical system,
yeah, he's like,
which was
this
interesting.
model isn't solving the root cause
And he
of
just
what's
started
going
to like really learn about the anatomy. And he's like, okay, if the anatomy is altered,
on.
structure affects function. And like an analogy I use a lot with my patients is like, if you have a nail on the wall on an angle like this, it can hold up a photo. Like you can put a photo on it. If you take that exact same nail, you don't change what it's made out of, you don't change nothing, and you put it like this, that can no longer hold a photo.
Mm.
Why? The structure has altered. The structure
Yeah.
has changed. Now the function has changed.
Mm.
So
Mm.
it's like water is another good example. Water, you can, like if you had a glass full of stones and you pour water, it can go through. But you change that water to a different temperature, like ice, now it doesn't. That the composition of the water hasn't changed, but
Mm-hmm.
the temperature changed, which means the function, like the structure has now altered. So now the function has altered.
Yeah.
So the structure function relationship is osteopathy, basically.
Mm-hmm.
It's like if the structure's changed, and then if structures change for too long, your body will actually adapt. So like you
Mm-hmm.
can actually see this in like the set joints of the spine. If someone has a side bend and their whole life they're kind of working through this side bend, you'll see like a lot more, wear and tear on those facet joints on the
Mm.
side of compression than you will on this side. So even if you did correct that and make that kind of function better, this side has a lot more wear and tear. So that's going to have more inflammation at that joint. Things are going to irritate it a little bit quicker. So like I think like when it comes to the body, the biggest issue that I see in the online world is if we can't prove something is equal for everyone, then it's not true. And that is like the furthest thing from the truth. It's people do that with food, people do that with diet, people do that with exercise. You we're all different. Our tissues can handle different stressors. You
Mm-hmm.
know, we all have different thresholds.
Yeah.
If I tried squatting 450 pounds, my legs would snap. But
Mm-hmm.
to someone, like they can probably rep that 20 times. So
Mm-hmm.
to say squatting 450 pounds is bad for your knees is not a logical thing to say.
Yeah.
So it's like when it comes to manual therapy, when people say, does PT work? Does
Mm-hmm.
osteo work? Does massage work? It only works if the practitioner is able to identify the problem,
Yeah.
provide the right assessment, and
Mm-hmm.
then give the appropriate treatment for that assessment. That's the
Yeah.
only way it works.
Yep.
And you brought something up earlier in terms of like, I forget what you said, but in terms of like the techniques for the shoulder. So let's just say
Mm-hmm.
me and you were to do the same shoulder technique.
Yeah.
How much pressure you use? Are you
Mm-hmm.
providing traction? What angle are you on? Do you notice that maybe this person's clavicle is like this, so you can't get the shoulder in the same position? Like there's
Mm-hmm.
so many little nuances and variables. Maybe that person has had shoulder pain for 10 years and they're a little bit more conscious of letting their shoulder come up. Well,
Mm-hmm.
if you were taught to do the shoulder technique at 90 degrees and that person's very irritated at 90 degrees, probably not a good idea. But if
Mm-hmm.
someone's taught that and they weren't taught to kind of work around it, now that treatment's not going to be very effective.
Yeah.
So you kind of have to like adapt on the fly. It's
For
like,
sure.
if you're playing sports, you could be taught something in practice, but when it comes to the game or the competition, sometimes you have to adapt on the fly. And the quicker and better you are at doing that, the better practitioner you're going to be.
I totally agree. And it's so hard to explain this on social media, because we're both, you and I are out there putting out content, trying to educate people, but you can never in a post get into all this
No.
nuance that goes into a treatment session, right? Like there are so many factors that go into it. You're interacting with a person, you've got the communication side with them. How well are you able to build rapport? The assessments you put in, how you're modifying, like you say, assessments and treatments on the fly. Like you just can't cover all that. And I think I agree with you so much. Like it really bothers me when somebody will say, "Oh, physical therapy didn't work for me," or osteopathy didn't work for me, or chiropractic. It's like, and they tried one practitioner. Like, don't throw the whole profession out because of that one
Exactly.
experience. Like, you've got to go kind of date in a way, like
Yeah.
test out different practitioners
And
and
give
find
someone
that person.
like a chance to like
Yeah.
people. One of the biggest issues with pain, and I'm sure you see this all the time. People put it off for
Yeah.
as long as they can until they can't. And
Yep.
then they come in and they want a quick fix.
Yep.
And like, we were kind of touching on all this nervous system stuff, and that like heightened sympathetic nervous system response is going to kind of eat away at the immune response. So now when you do have some sort of pain, your body's ability to recover is a lot less. So now certain things are hitting your thresholds a lot quicker. So like people have to realize that now you have to retrain your nervous system, and like that takes a while.
For
Like think of
sure.
how long it takes to unlearn something.
Mm-hmm.
Learning something is one thing, but to unlearn something,
Mm-hmm.
that's a whole other ball game. Like it's very difficult because our body gets so efficient at working a certain way that when
Mm-hmm.
you start to change it, like things get really kind of shaken up.
Yeah.
And one of the difficult things is we don't actually see what's happening on the inside. So
Yeah.
it's
Yeah.
hard for like patients to understand that a lot of change is happening, even
Mm-hmm.
if you're not necessarily doing a lot.
Yep.
And I
Yep.
think that that's in the near future. I think there's going to be some technology that can show us, what's
See more of
happening
those
underneath the
internal
skin.
things.
Yeah.
I agree. Yeah, I think there's a company here in where I live that makes thermal cameras, and they mainly use for like the military and things. But I always think, and I think they're doing some research in the body to be able to see kind of like areas of inflammation and kind of see
Interesting.
like warmth within the body. And I agree with you. I
That would
think,
be so useful.
oh yeah, because with the MR, with our current imaging, MRI, X-ray, like yeah, sometimes you can see things, but sometimes you've got people who've got quite a lot of pain, but there's nothing on those imaging studies, and I think there's clearly something happening. We just don't have a tool to measure that at this point.
I think with the imaging, like my biggest issue is that it's a still shot. It's like
Sure.
a snapshot. You
Yep.
don't see how things are functioning collectively. And
Yeah.
most of the time, dysfunction happens with function. So it's
Hmm.
not like it's not, even like an MRI, for example, like you'll see a muscle tear or something, but someone could have shoulder pain because their shoulder's unable to kind of glide like within the joint. You don't
Yep.
see that on a photo,
Mm-hmm.
unfortunately.
Mm-hmm.
There could be some compression, like maybe they fell on their arm and their joint got compressed. And now all they really need is some gentle traction to kind of create some more movement. But it's like if the joint's like this, there's nowhere for it to go. Like,
Mm-hmm.
it kind of needs to be sitting a little bit more free. So like you don't see those things on imaging.
Yeah.
So a lot of my patients, will ask me, should I get imaging? Should I not get imaging? And in Canada, as osteos, we're not allowed to give that advice. So
Mm.
that's like, we're not doctors here. So we don't treat medical conditions. We treat the body, which, like I
Yeah.
said, we have to understand what's going on. But
Yes.
like, we don't have a specific treatment for like this diagnosis. We try to get a collective viewpoint of the body, even if they are experiencing, a medical condition. But we can't diagnose. We can't ask for X-rays, imaging, anything like that.
Yeah.
So, I just kind of like leave it open-ended. I said, talk to your doctor.
Yeah.
Usually I can get an idea of like if something's severely wrong,
Mm.
then obviously we have to be able to identify red flags and
Yes.
send them
Refer
out.
them back. Yes.
That's a big thing too. So I also tell people like, come for a checkup every once in a while. Like I'm not going to diagnose you, but we have a pretty good idea if there's something not
Mm-hmm.
normal in the body, to
Yeah.
at least go see a doctor and get it checked out.
Yeah, you're kind of similar to us. Like I can't order imaging, but I would, I look for red flags, and if
You're
there's
allowed to
something.
say medical terms though. I've seen on like your
Oh
content and
yeah,
stuff,
you
right?
can't
Yeah.
say that. You
No,
can't. Oh really?
no, I actually got in trouble from the association because I used plantar fasciitis in one of my posts.
Oh,
And
you can't even say a diagnosis, like even imply that
no,
that's.
no,
Oh,
which
oh,
is very limiting when it comes to content because people, one, don't really know that we understand it because we can't talk
yeah,
about it.
that is very
And
limiting.
two, we're not allowed to say like we treat those. So like, on your sign in your clinic or in your intake form or whatever, like we can't put any of that stuff. So that
Wow.
also makes people confused as to how we can help and what we can help with.
Mm-hmm.
Like
Totally.
digestive issues, like inflammation, and things are called for what they are. Like inflammation of the gut, you'll
Yeah.
get something like IBS, right? Or like something like that. It's like we're not allowed to say that we treat the IBS, but obviously we have to understand what inflammation is, what causes it,
Mm.
and how to improve inflammation. So we
Yeah.
can still help treat it, but we're not treating the condition. We're treating the patient.
Got it. Got it. So
You
what
know,
about something like low back pain? Can you say you treat low back pain?
yeah, yeah, because that's
Okay.
not a medical condition.
Okay. It's kind of
Like
a tricky one because it's like it's a little bit of a
like
gray area. It seems.
pain is fine because pain is
You can
pain.
just say pain. Yeah. Yeah.
Yeah, I
Okay.
could say pain. Like they told me to say instead of plantar fasciitis, like heel pain or foot pain. Like that's
Yeah.
fine.
Yeah. Yeah.
Um, yeah, so it's kind of like a tricky line, but I don't understand what my kinesiology degree is for then because I learned all that stuff in kin. So,
Yeah. Yeah.
like if I just had that osteo background, like I get it, but I also have the kin background, so I'm very confused
Yeah.
as to why we
So
can't say those things. But
does an osteopath in Canada, do you have a license? Like as a healthcare, how does that
so
work? Like would it
it's
be
not
like a physio or something?
it's not regulated the same, but we have insurance coverage. So like
You do.
I can people can use their insurance coverage for treatment. So it's
Yeah.
covered by like 99% of insurance companies, depending on where you went to school. But because osteopathy is not regulated in Canada, there's a lot of different programs. There's like programs that are 6 months, programs that are
Hmm.
2 years, and then our program
Uh,
was 4 years. So you
also
get
vary a lot.
a very differential hierarchy in terms
Mm.
of experience and knowledge when it comes to
Hmm.
osteopathy. So kind of like what you said, try another practitioner, give
Yeah.
someone a chance because you could see a practitioner here that doesn't even know what the lymphatic system is, and they're treating you as an osteopath.
How do people come to see you? Like, do they go see their doctor? Or is it usually people who are going other places in the medical system and not happy with their experience and they find an osteopath,
Yeah,
or are they referred to you? Or,
I'd say more the first one because most
uh-huh.
people don't know what it is or what we do.
Yeah, totally.
So
Yeah.
most people like come into the office and they're like, I'm not really sure what osteopathy is, but I've tried everything and nothing's worked. And then they'll
Mm-hmm.
come here. It poses the challenge because we get the challenging cases.
Mm-hmm.
But once you understand, like, here's the basis of osteopathy. You have to understand, obviously, the anatomy. You have to know all of the anatomy. That's the foundation. If you don't
Mm-hmm.
know all of the anatomy, you can't have an accurate assessment because something can be happening and you're missing it.
Yeah.
So it's like, the average person that puts their hand on a body, they're just like, oh, I just feel some soft stuff and some hard stuff.
Yeah. Yeah.
Whereas like when you understand what's there, you're like, okay, superficial is the fascia, and then you
Mm.
got the pec major, then you got the pec minor, then you got the intercostals. And the deeper you put the palpation, the deeper you can kind of feel these things. And
Yeah.
then knowing what level you're on and what tissue that is, and then checking that tissue's function compared to like the tissue superficial to it. Like there's a lot of little detail when it comes to it, but knowing the anatomy is number one. Then knowing its function.
Mm-hmm.
So knowing what the thyroid does, knowing what the glands in the face do, knowing how the eyeball functions, knowing how the eyeball, communicates with the back, like just knowing everything,
Mm-hmm.
knowing all the nerves, all the blood vessels, the pathway of blood, the pathway of lymph, the pathway of the nerves, how, we had to learn like spinal tracks. So like even when a nerve signal goes into the spinal cord,
Mm.
they have specific pathways that they go up, and,
Yep.
you know, pressure shares a similar pathway to pain. So this is why sometimes applying pressure can desensitize things. Like there's a lot of, little nuances you can do in treatment, but you have to know it
Mm-hmm.
and you have to understand it. And then you have to be able to assess. So then obviously the next step is your palpation. You need to know that you're on the right structure. You can't, if you're trying to, get an assessment of L5
Mm-hmm.
and you're on L3, well, L3 has different motion capabilities than L5. So if
Yep.
you're testing L3, in rotation, the facets go vertical. So like you're not going to get much rotation. So knowing where certain movements should be happening.
Mm-hmm.
So that way, when you're assessing a patient, you're like, okay, this area doesn't move the way it's supposed to, this area doesn't move. And then you start to build the picture. And then the last step is knowing how to treat that area to improve what the normal function should be.
Mm-hmm. Mm-hmm.
And that's the overview. So it's
Yeah.
like, if the treatment doesn't work, then one of those steps are wrong. Or if all of those steps are right, then that person hasn't given it long enough to actually see and feel changes.
Mm-hmm.
Like we were talking about, if you get ligamentous changes where the ligaments start to thicken, ligaments don't just loosen up like muscles. They don't have the
Mm-hmm.
same blood supply. So
Yeah.
like it takes a lot longer to kind of get a ligament to start to let go.
Sure. Yeah.
So
Yeah.
it's
So
interesting.
it's super interesting. It's like that was really helpful. Thank you for kind of walking that through. And it's actually physio and osteopathy are actually really similar. I think the difference I'm hearing is that I think you guys, like when I went through undergrad and through physical therapy school, of course we have like general physiology courses where we're going through all the different systems in the body. But I think it sounds like in osteopathy, you guys do a little bit more of thinking about kind of like you were saying, maybe that whole person kind of view of like, how could this non-musculoskeletal system influence the musculoskeletal system?
Exactly.
It sounds
And
like there's
and
more of
the
that.
musculoskeletal system it'll always tell you what's wrong. Like the
Hmm.
body has reactions and responses.
Sure.
So if, you know, the immune system is compromised, you'll have certain symptoms. If
Yeah.
the nervous system is compromised, you'll have certain symptoms. The body tells you what's wrong.
Hmm. Yep.
So like, when I have a patient come in and they're giving me their intake and they're giving me this whole life history, like it's important. I got to get an idea of where they're coming from.
Sure.
But majority of my treatment is just based on how things feel.
Hmm. Hmm.
So like, if you feel a muscle knot, like this, there's this whole world about muscle knots, right? And
Yeah.
it's
So
like,
it's a lot of
it's
fighting in
like,
that world.
but then like you'll check a cadaver and you'll never find
Hmm.
a muscle knot. So
Hmm.
explain that. But a muscle
Yeah.
knot is just an involuntary contraction,
Hmm.
and that contraction is not letting go. Whether that's like in the deep intrinsic muscles of the spine or the superficial muscles, it's an involuntary contraction. Now, what would cause an involuntary contraction? Well, there's multiple things. If the muscle doesn't have the right nutrients, it can
Hmm.
kind of go into spasm. So like calcium,
Yep.
if we're not hydrated, whatever, we kind of know those superficial things. Maybe you've oversensitized the nerve that goes to that muscle. So maybe, you ran 10K today and it was a little too much for that one area of your body because maybe yesterday you worked out that area and it's
Hmm.
just, you've now passed your threshold and now it just kind of went into spasm. So that's another option. Maybe it's compensating for something. So maybe you slipped on one of your stairs and something kind of like caught in contraction to kind of protect the joint. But
Hmm.
sometimes you need that external force to direct, what treatment to that area to let that relax. Like
Sure.
sometimes those involuntary contractions can stay. Like the
Hmm.
body will just adapt into that,
Yep. Yep.
which is interesting. So like
Yeah.
it's a problem
Even
if it lingers
psychological
there.
stress, right? Like I notice for myself, sometimes I'll have
I wanted to touch on
involuntary.
that too.
Yeah. I was going to ask you because like that, there's so much of this psychosocial, biopsychosocial model in physio these days. And I know for me, I had this jujitsu injury back in the day, and a lot of people have heard me talk about this, but it was a injury when it started, kind of a more nociceptive, kind of mechanical, straightforward, maybe more straightforward, like physical injury. Like I hurt a rib, and it was at the time in life where I was really stressed out. I was in a job that was stressful. My kids were really little. There was just this perfect storm of kind of stress. And now I notice these days it's on the right side of my thoracic spine. It's about the size of a quarter. The only thing that really triggers it is psychological stress, even sometimes if it's good stress. And like maybe I'm going to go on vacation the next day, and the night before you
Interesting.
don't sleep as well. And a lot of times I think that I tend to, when I'm in a sympathetic state, maybe in an involuntary way, there's a memory there, and I think that I hold a bit of contraction in those thoracic extensors. One of the levels of my thoracic extensors, in the beginning when it was getting going, anything I did that was an extensor dominant exercise like deadlifts or bent over rows would trigger it. That doesn't happen as much anymore. It's mostly psychological stress, but
Sure.
I think what you're talking about is so interesting, and it tends to be the way I lean now, where a knot, like what we would have called a knot, isn't something you can find usually on imaging, like an adhesion or
No,
something there, but more of like a almost maybe a sensitivity in the nervous system or like a involuntary muscle contraction, something that we don't, like we talked about before, we don't really have a good tool for measuring it right now.
exactly. Besides palpation, like you
Yes.
can palpate that easily if you're
Mm-hmm.
trained to palpate it.
Mm-hmm.
So another thing that I notice in the manual therapy world is like a lot of people love to use tools, but like
Yeah.
our hands
Oh
are the
yeah.
best tool. And I think patients kind of undervalue that because they're like, oh, you're just using your hands. Like this
It's not as
can't
good as
be
this
as,
tool or
yeah.
something.
Like if I
Yeah.
had a $10,000, you know, anything, like people are like, oh my God, like I'll pay you so much for this treatment because you're using this crazy technology. Meanwhile,
Totally.
nothing beats the hands if you're trained,
Mm-hmm.
and like in our schooling, they would actually make us palpate people through like sweaters and multiple layers of clothes to
Yeah.
really start to feel and sensitize your hands. And my hands are still getting more sensitive, but since I graduated, like I can pick up on things a lot quicker. Like I
Mm-hmm.
think, well, actually, I don't think I know. I can do an entire treatment blindfolded
Mm-hmm.
just based on feel because
Yep.
I know what things should feel like and I can so that's kind of cool because like I don't
Yeah.
really have to, visuals give us cues. Like,
Mm-hmm.
I'm always looking at people to see if they're kind of squinting if I'm doing something or like if they're uncomfortable, it kind of gives me cues
Sure.
and you can see how their skin health is and whatnot. But for
Mm.
the most part, it's all by feel.
Yeah,
It's
yeah.
just motion
Palpation's
testing.
so powerful. I agree with you. I think we have these amazing tools, our fingers, that have all of these sensors that give us feedback on our nervous system. And it's so interesting to see how it changes because I feel like when I first got out of school, everyone really valued like the touch of the hand and what you could find with that. And then all these tools started getting introduced. And I agree with you. It's kind of interesting now to see patients kind of start to value like tools.
They
And I
do.
still am like,
Like
man, my fingers are
if
so
you
much
pull in
better.
a massage gun and a couple other things in your treatment, people are like, "Wow, I got so many things done to me today," even though you can get the same thing done with your hands.
Oh, and it's so much better. I feel like when I use
Well,
those tools, I feel like I'm so much
just
less effective. Yeah.
because you can control the pressure.
Yep.
Like even with a massage
Exactly.
gun, like even if you pull it off to get lighter,
Mm-hmm.
the vibration doesn't really change. But
Yes.
if I'm oscillating a patient, I can either oscillate them quickly or I can oscillate slowly to be more
Yeah.
rhythmic, depending on what I'm trying to do to those tissues.
For
It's just
sure.
like it's like having a conversation with the tissues. Do the
Mm-hmm.
tissues need a little bit more force? Do they not? You got to be
Yep.
able to identify that with your touch. And then, sometimes I'll think that a patient needs something. I'll go to try it and they'll kind of like have a certain response. I'm like, okay, well, that tissue doesn't want that. So then I have
Mm-hmm.
to adapt and kind of find something else to get the same effect, but through like a different approach. You're
Yeah.
kind of like sneaking in. So,
Yep.
like, I'll give you one example of that. Let's say I'm trying to lengthen someone's hamstring. Okay, we'll
Okay.
just keep it simple. So I'm trying to lengthen someone's hamstring, but it gets to a point where like the muscle will kind of spasm, like it gets to like their end range. So they'll
Yep.
kind of contract. So what you can do to lengthen the hamstring at that time is like reciprocal inhibition. So like you can get them to the point just before contraction, get them to contract their hamstring into you. So like
Mm-hmm.
maybe you keep the leg straight, they push into you. You just kind of wait a couple seconds, and then you get them to gently relax and you slowly ease into the new barrier right before they have that reflex again. Then you do it
Mm-hmm.
again. They do contract. And next thing you know, like after 3 or 4 of these treatments, you've gained, 10, 15% of mobility, but their nervous system hasn't registered because
Mm-hmm.
in a muscle contraction, like we have like a refractory period where like
Mm-hmm.
the muscle has to like recover before it gets to neutral. That refractory period is kind of where we take the tissues to the next level, and then right when it recovers, the body's like, oh, we're back to where we started, but it's actually a little bit further. So it's a really, really cool way of
Yeah.
like getting more range without stressing the tissues.
I agree. Those techniques are so cool. Like a lot of times in PT, we'll call them contract, relax, or
Yeah,
PNF kind of
same.
type
Yeah,
drills. Yeah, it's
same
all the
idea.
same stuff.
It just depends
And
if you're going like direct or indirect to the.
yeah. And I've heard a lot of people in kind of the neuroscience world talk a similar in a similar way to you of like it helps desensitize our stretch receptors, like our muscle spindles and things, and
Exactly. And
sort of
usually
brings in
that's
that.
what's irritated. So
Yeah,
then
it's like
what
you're.
do people do? People will stretch. So
Mm-hmm.
people go to stretch an irritated muscle,
Yep,
and a lot of the time it actually makes the muscle tighten up harder because now
for
they're
sure.
those stretch reflexes are like contracting. They're like,
Yeah,
hey, we need to stretch it out because that's logical, right? Like to
yep,
lengthen it, but then it
yep,
contracts harder. So
yep.
sometimes like what I'll do in that case is like I'll actually slacken the hamstring like a lot
Mm-hmm.
with
Mm-hmm.
pressure.
Uh-huh.
So now I'm
Yeah.
desensitizing like with the pressure. So that's kind of like overriding that like neurological pathway. And then I'll slowly like lengthen the hamstring with that pressure maintained.
Yeah.
And then same thing, like when it gets to that point, get them to either contract or relax. And you kind of play around and manipulate using
Yeah.
different, sometimes maybe I get them to contract the quad so that the hamstring shuts off.
Sure.
So
Reciprocal
like it,
inhibition there. Yep.
yeah,
Mm-hmm.
sorry, that's what I meant. The first one was
Yeah,
post
yeah. Yeah,
isometric relaxation. But anyway,
yeah. Yeah.
they're both
Yeah. Mm-hmm.
useful. But
Yeah.
like sometimes you got to kind of, play around with it. And like sometimes it might work when you're kind of coming in on this angle, but then you try to go a little more and it doesn't work. So you kind of have to like move on that angle to get more on that angle. Like
Yes. It's like you said, it's a conversation of the tissues, and you realize that people who do this and work with their hands, anything, it has an art to it.
it is
Like
an
there's
art.
an
It
art, like
is.
there's a science and an art. And like you can go learn the anatomy, the structure and the function, all these things. But until you've started kind of feeling somebody's tissues and interacting with that person, everyone's unique, feeling how their body responds and changes as you move them, put pressure in different areas. It really bothers me sometimes online because there's so much pushback these days on manual therapy. And I get
It's
that the
because people
research on it,
don't understand it.
they
That's
don't
that's
really
it.
practice it. Exactly. I think they
Or
don't have a lot of
they're not good
experience.
in getting results. So they're
Hmm.
like, it doesn't work. And what do
Yeah.
people do when something doesn't work? They push harder.
Yeah. Yeah.
So now imagine all this stuff we've been talking about, and now you're trying to force things in the body.
Hmm.
It has
Yes.
complete negative effects.
Yes.
The body is it's smart. Like when
Mm,
it perceives a threat, it's gonna, shut down. And
exactly.
I wanted to touch back kind of on the psychosomatic stuff,
Yes. Yeah. 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 Yeah.
but the thought of a perceived threat can
Hmm.
actually stimulate the exact same stress response as the threat.
Exactly.
Sometimes worse, because how you perceive it might not actually be as bad as what it would happen if you went through it. And this is kind of like some of the basis of anxiety too. It's like those constant thoughts create physiological changes in the body and structural changes, like the rib cage will kind of tighten up and everything will kind of protect the organs and everything kind of shuts down. But then all of that tension reflexes back to the brain where like the
Mm,
brain can't get enough oxygen. Now your rib cage isn't expanding, you're not getting enough circulation. Then that starts to the brain starts to panic and then you start to have more of those thoughts and it like things don't happen just from like one thing. Like it's a
oh,
process.
exactly. And it's so true. I mean, there's so many cool studies out there where they'll make people believe that something is going to happen to their body. So they're introducing a
So,
threat that's fake, but they
and
make
they'll
it
measure
seem
their
like it's
brain.
going to happen. Yeah. And then in a lot of those studies, people will report experiencing pain even though nothing really happened to them.
Yeah,
Lorimer Moseley, this famous pain neuroscientist, does a great one with red and blue lights, and they touch people on the back of the hand with a metal rod, but the metal rod's always the same temperature. But they'll either show them a red light or a
interesting.
blue light, and then they'll
And they'll
ask people,
feel
yeah. So the
what
people who
like
see
different
red light
temperatures.
report more pain because red to us means hot. So
Interesting.
you look at the International Association for the Study of Pain, they'll basically say now that pain is an emotional and a sensory experience associated with
Oh,
actual or potential tissue damage. So you could have
interesting.
actual tissue
Interesting. That's
damage,
a
but
good way to put
you,
it.
I like that potential tissue damage because even if you just feel psychologically threatened that something's going to happen to you, that in itself can cause pain. And then, like you said, all the secondary kind of tightening and guarding and all these things, then you can get into that kind of negative cycle where those things, they all feed off each
Exactly. It's
other.
in
And
feedback loops, right?
yep.
And this is why I stress one thing in my practice with any patient. I always, always, always give the patient hope.
Yeah, it's
Always,
huge.
always. Because there's always something you can do to make the situation better.
Yeah.
Unless like you're bedridden in a coma, like I don't really have an answer for that. But
Yeah.
for the most part, you can always, always, always improve the scenario. What people think is if you're like very compromised, people are like, Well, you can't get back to 100%. So don't do anything. Like I know a lot of doctors say, stay off the exercise or don't do this. Movement and exercise is always the answer. What movement, how much, when, in what way, using what, those are the variables that need to be altered. So it's like if
Mm-hmm.
someone's having knee pain, and they have knee pain every single time they squat. Well, it's not a good idea to continue squatting. But what can you do? Maybe you just start holding a chair and just go into gentle flexion and come back up and start to build the tolerance. Oh, that didn't cause any pain? Okay, no problem. In day two, now we're going to go to a wall sit and we're going to maintain that tension. No pain? Okay, maybe we're going to do a wall sit with a little bit of weight. No pain? Well, now let's get the range going. Okay, great. Now maybe let's work on the, like, there's always something you can do. And I
Mm-hmm.
think like when you scare people into the sense that like there's nothing they can do, or like just like back to this perceived threat, it's like if you tell them that they're super compromised, even if you know they are,
Mm-hmm.
and you kind of like give them a little bit of that fear, like they're gonna act very protective with
Mm-hmm.
everything they do. And sometimes that can actually cause more injury. It's like,
Yeah, you're just upping the threat more.
yeah, like when you feel confident in something, you don't overthink it.
Mm-hmm.
It's like these people that walk on like these balance beams. Like
Yeah,
they
yeah.
don't even think about it. They just walk on it, right? But if we walked on it, we start to panic and then all of a sudden we lose balance.
Yeah.
It's not because we can't walk straight. If we were walking on solid ground, we'd be able to walk straight. But
Yeah.
now it's a perceived threat of falling
Mm-hmm.
and
Mm-hmm.
everything starts to alter. And that's a good example. And then another
Yeah.
good example that I just wanted to touch on, I don't know if you got to go soon, but
Yeah, no, it's
is
okay. You're good.
visceral somatic reflexes.
Uh-huh. Yeah.
So like there's psychosomatic reflexes, but there's also visceral somatic reflexes. So how do us as osteopathic practitioners know if an organ
Mm.
is having some sort of stress or dysfunction? Well, obviously based on the symptoms that that person's experiencing, or like their ability to regulate hormones or digest food or have a regular bowel movement, like that gives us kind of the initial insight. But also like when you have organs that are dealing with dysfunction, neurologically, like there's reflex loops and a reflex doesn't have to reach the brain. So like these reflex loops are like from organ to spine
Mm-hmm.
and spine to organ. So
Yeah.
like that signal doesn't have to communicate with the brain. So the interesting thing is like, let's say you have, a lot of lesioning from like T4, like T1 to T4, like upper thoracic. Okay.
Mm-hmm.
A lot of people talk about forward head posture, and I will touch on posture too, because I think
Mm-hmm.
that's like a really, really big topic.
Yeah.
But let's just say someone, has like flexion through the upper thoracic and it can't go into extension. So it's affecting their shoulder mobility, their breathing, like it's affecting all that blood flow to the head. A lot of people are like, oh, these muscles are tight, right? Or it's because your head's forward that this is tight. But let's say you just had COVID and you had a respiratory illness
Mm-hmm.
where your lungs and your heart and your pleura and all this stuff in the throat was going through a serious battle. Neurologically, those autonomic nerves, so like those sympathetic nerves from T1 to T4 that supply the heart and lungs, you could get tightening around those joint segments because those organs have been irritated.
Mm-hmm.
So a lot of people like they'll come in and they almost like feel guilty when like certain areas of their body don't move. They're like, oh, I know I should have been stretching.
Oh,
Oh,
yeah.
I don't know why this is tight. I do yoga every day. It's like, okay, but those things matter to a point, but like there's other things that can influence your body through the autonomic nervous system that are out of your control. It's just your body's response to something.
Mm-hmm.
Now
Mm-hmm.
we can help relax those reflexes in treatment, but it's not really necessarily your fault that you're experiencing it.
Yeah.
And I think
Yeah.
that's important for people to understand.
Yeah, that's a good point because a lot of people do feel guilty about that. You hear a lot of patients say, "Oh, I know I should be doing this more," and they kind of
Yeah.
feel down on themselves. And I think, when you think about just physiology of the human body, it's amazing. Like how all these things, because like you say, all these organs share spinal nerve root levels just like our muscles do,
Yeah.
and there's interaction between all those systems. And it kind of gets back to I wish it'll be so cool when we can measure all this stuff in more
And that's
detail,
the hard part. And that's why it's
hmm
not fully
It's like you can't
understood.
prove it. It's hard to prove any of this stuff.
It
Like,
is, and
because
it's
you'll get a
because
lot of,
it's so different with each person. So it's not like
yes,
if you proved it on one person, it's very hard to replicate because their pattern is different.
every person's a new experiment. I always tell patients that like you are a new experiment in a way, and there's a lot of trial and error in this process of us figuring out what's going on with your system and what's going to work for you. And there's a lot of factors like the physical factors, the psychological factors, the all of the stuff that goes into like the communication with the person, like the rapport, the therapeutic alliance that it's referred to sometimes. I love what you said before about just having the goal of giving the person hope. I think that's so huge in rehab, right? Because I think unfortunately there's a lot of practitioners out there. who intentionally or unintentionally kind of scare people and don't reassure them that most things get better with time. And they kind of sometimes will. I think so much of what we do should be to help people kind of boost their self-efficacy and help them kind of believe that they
Totally.
have some control and can do something about this. Like there's something you can
Think
still
back to
do.
that psychosomatic
Yeah.
aspect.
Yep.
Now they're feeling powerful. They're feeling in control.
Yep.
As soon as someone doesn't feel in control of their body, it's like it's kind of game over. Like in the
Mm.
short term, it's not
Yeah.
game over forever, but you can't expect the body to heal and self-regulate if you're not feeding it the thoughts that it can. Now,
Yeah.
when people disregard thoughts, this is what I say. People go, "Oh yeah, sure." Like you just think you're going to get better and you get better.
Mm.
Okay, well, think of something that makes you throw up and tell
Mm.
me why it makes you throw up.
Mm. Mm-hmm.
You just
Totally.
thought about it.
It's a
It's
good
not there.
example. Yeah.
You're not smelling it.
Think
You're
of
not
something that
looking
makes you
at it.
anxious or so. Yeah,
And
exactly.
yeah, like we know that there's physiological changes to our
Mm-hmm.
thoughts. So those are just as powerful. And like we know that the thoughts in our brain directly influences the gut as well. And the gut health directly influences all tissues health, depending on how much nutrients and we're absorbing. There's so much emphasis on supplements and diet. I mean, diet I think is extremely important.
Yeah.
Stick to whole foods and
Mm-hmm.
keep it well rounded and get your protein, and like those are all
Yes.
like those are the foundational stuff.
Sure.
But but if you're eating all that stuff and your body's not able to absorb it, then you could spend all the money you want. It's like you got to fix the system first.
Mm-hmm. Yeah. Totally.
Then everything will start to kind of work out. Like even if you just talk about cortisol levels,
Yeah.
stress, that's going to directly influence digestion too.
Yeah.
Starts to
Yeah.
affect blood sugar levels and insulin, and everything starts to kind of go crazy. And like I was even kind of going down the rabbit hole of like how increased insulin can actually kind of lead to diabetes, just like
Mm.
glucose resistance, which is
Mm-hmm.
very interesting, just from like affecting levels of blood glucose like over a prolonged period. And
Mm-hmm.
that's the thing, like the body can regulate until it can't. Like
Yes.
if you continue to stress it, and I kind of use like an example of like a bicep. Let's say you can lift 30 pounds for 10 reps. At some point, that tissue is going to fatigue, right?
Mm-hmm.
And then you need to recover long enough for that to recover and regenerate until you can do it again. Now, the older you get, the more health complications you have, the less of an ability your body's going to have as to like recovering and regenerating. So like that curve might look a lot longer than like someone who's relatively healthy.
Mm-hmm.
And that's another important thing for patients to understand is like their treatment plan is relative to their current health status.
Mm-hmm.
Like if they're extremely unhealthy, they will
Yeah.
not heal and recover the same rate as
Yeah.
someone who is. That's
Mm-hmm.
like that's just factual.
Mm-hmm.
It's like putting bad gas in your car versus good gas, driving
Sure.
in the same kilometers and saying, how come my car went more kilometers than yours?
Yeah.
It's relative kind of to this scenario, but we can always improve those things.
Yeah.
There's so
Well, no.
many.
Yeah, I totally agree. It's on that point. It's like you think about all these things that boost regeneration and healing, like sleep, avoiding alcohol, avoiding smoking. Like you said, if somebody's unhealthy and they have a lot of those things off, their healing potential is way less. I mean, surgeons won't even take people sometimes, right? If they're smokers, they won't even take them. They know that tissue's not going to heal well, and they're not going to, their outcome, a good outcome, is less likely. And so I agree with you. I think it's like you said, the system has this amazing ability to heal and recover, but if you push it too far, you do see situations where it seems like people just get pushed past a certain point, and then their body gets
I
into these
actually
kind of,
have like
yeah.
one of the best quotes. It was from an osteopathic book. I just screenshotted it,
Mm,
and
mm,
it was about stress. But
yeah.
let me see if I can find it quickly.
Well, you see like autoimmune disorders come about all of a sudden. I have a patient with multiple sclerosis, a form of MS. There's some more research on this now looking at, he's got plaques on his spinal cord, but he actually got it from getting a virus. He went to Africa and he got a virus, and that triggered
Interesting.
this autoimmune change. So I think sometimes the system, it is amazing what our system can heal from and adapt to, but sometimes you push it too far. And I think, like you said, nutrition is so important. And I think we have such a pro-inflammatory diet in Western cultures. And it's pushing your system. You look at all the metabolic issues and the inflammatory issues. So much of this is wrapped up in our overall health and function, and to ignore nutrition, to ignore sleep, to ignore stress management, to ignore the health of your other systems, it's just irresponsible.
Hmm.
Even when
And
even
they
if you
just
think you
want
just
that
have a
quick
straightforward
fix.
pain issue, yeah, like even if you think just pain, I've got back pain, it's just a straightforward thing. You need to be thinking about all those other
All of those
factors. Like they're
things.
so
Those are
intertwined.
the foundations of
Mm-hmm.
of our well-being.
Yep.
Okay, so I
It
found
was a
it.
quote. Yeah, yeah,
You'll really like this. Well,
yeah.
it's like a paragraph, but I'll read it because
Mm-mm.
it puts things into great perspective, like in a way that all of this kind of makes sense. And it's basically like your body just has a maximum threshold. And if
Yeah.
you push past that too much, then that threshold starts to come down. And basically, like now this is your new threshold. So all those things that might not have affected you before are now affecting
Mm,
you.
got it.
So, okay. So we speak of the restoration of autonomic flexibility as a positive therapeutic effect on the. Okay, so hold on. The autonomic nervous system maintains the vital functions and helps one survive without the need of conscious thought. It has two major divisions, sympathetic and parasympathetic. The sympathetic division causes the body to respond to danger, adversity, stress, anger, and ecstasy by increasing heart rate, blood pressure, air exchange volume, blood volume to muscles, and all other things which are needed to spring into action. The parasympathetic directly monitors body functions during times of rest, sleep, food digestion, elimination, etc., when the body is not ready to spring into action. As stressful situations occur in daily life, the sympathetic system is activated over and over again. Frequently, it cannot discharge the accumulated stress because modern society does not allow sufficient opportunity for the body to spring into action so as to dissipate the energy generated by the stimulated sympathetic nervous system. Therefore, the level of tone or tonic activity of the sympathetic system increases. Day by day, as we accumulate more energy from stressful stimuli than is dissipated, uh, this increase in sympathetic nervous system tone causes the heart to speed up, blood pressure to rise, stomach to tighten, and bowels to move toward spasticity, and the blood flow to be diverted from vital organs to muscle. Left in this condition, the body will not survive very well. In order to counteract the condition of readiness for fight or flight instituted by the sympathetic hypertonus, the parasympathetic nervous system has to act more powerfully to slow the heart rate, lower blood pressure, aid in digestive process, and reduce spasticity of the bowels. If the stress stimuli keeps coming in, the balance sheet shows more stress stimuli being received than is dissipated, so the sympathetic tonus continues to rise. And it just kind of talks about how, like,
Mm-hmm.
we basically should be able to regulate here. If
Yeah.
sympathetic tone continues to rise and parasympathetic tone never gets that chance to come up, now you're dealing with people in this level of sympathetic
Mm,
to parasympathetic tone.
yeah.
You cannot make changes to blood pressure, heart rate, digestion. It doesn't matter what pills you take, what diet you try, until you get back to this.
Yeah.
Nothing
Yeah.
matters.
Yep. I think stress underpins so many people's issues. Like there's all these other factors, the sleep and the nutrition, all these things, but I think so much of it is the stress, that sympathetic. There's this our culture, it's just grind, hustle, get
Yeah,
this done, do that, like stay busy. You've got all these things you've got to be thinking about doing. Like every time I travel, we were just in Indonesia this summer. Indonesian people,
so
Balinese
different.
people, they a lot of times are just sitting and relaxing. They're like just sitting, watching the world go by. They're with family and friends. They're not trying to hustle and grind. And
Europe
I
is
think,
like that too.
dude, it's a reminder to me. Yeah, the Europeans are much different than us. Like, I think Canadians, Americans, like, there's just this culture of like you've got to hustle and grind, and social media encourages that even more. I know for me, I have to think a lot about like just take a break. Like you only have one
Hmm.
life to live. Like get that balance sheet back in order. Like let the
It's tough.
parasympathetic. Yeah, it's
It's
really
tough,
tough.
especially
Like
when you're
you've had,
running a practice, and
yeah, you got your business. You got to get, it's like
it's
you got
it's t- it's
to
tough.
totally.
But
But I
even
agree
too,
with you.
like
I think it's such
different
a big,
stressors. Sorry, go ahead.
yeah. No, I just think it's such a huge component. So many of the patients I see, I think they're not always aware of it, but I think it's like the main driver in a lot of
Hmm.
what's going on with them.
And you got to make people aware of it, but not in a way to stress them out. Like you can't
Sure.
just say, stress
Yeah.
less or stop stressing.
Yeah.
It's like
Yeah. Yeah. Yeah.
it's like
Yeah.
okay, well, try to identify what are the
Mm.
stressors in that person's life. And we're kind of a therapist in a way as well. Like you gotta
Hmm.
maybe give them a new perspective and just say, okay, like, look, I think, the situation's not as bad as you're thinking, maybe this is why, try this, see if this makes you feel a little bit better. Um, like I said, there's always something that can be done. But when
Yep.
it comes to stressors are not just like mental stress. Like a lot of people just think stress is mental stress. There's
Yeah.
physical stress. So like the body having
Oh,
stress.
sure.
So that's where different postures come into play. Because if your body's holding non-neutral postures, that is a stressor to those tissues. Like we have tissues that balance on the front and back. And if one is pulling a lot more, this side wants to contract to bring you back to neutral. And if it can't, you get like this battle here. That's a stress. So whether
Mm.
your head's sitting sideways, whether you have hunchback, whether your ribs don't like inhale, those are all stressors. But then
Mm.
there's other stressors like toxins and things in our lifestyle.
Yeah,
So
sure.
toxins in the air, toxins in
Mm.
your house, mold, stuff in your cleaning products. Like products are filled with crap. unfortunately.
Yeah.
Like there's not a lot of products out there. Well, now
Yeah.
they're starting to become more popular that are clean,
Yeah.
better ingredients. But those are stressors to the
Mm-hmm.
body. So now you're getting stress to the body from all angles constantly. You know,
Mm-hmm.
even not getting back to someone on a text message is a stressor to the body.
Sure.
Thinking about a meeting is a
Mm.
stressor for some people. And
Yeah.
again, this goes back to like perceived threats. Like if someone gets really passionate about a meeting, like today, like I was excited to get on this podcast with you
Yeah.
because I was excited to talk about the body, but to someone that might not really understand the body, they're like, oh my gosh, what if he asks me this question that I
For
don't know
sure.
how to? Now, the same scenario is completely different in terms of how it's affecting that person's
Mm.
body. So I think the more people kind of understand these things, I think people can start to pick their battles as to like, should I stress about this? Okay, these are some things that I can change. Like a couple of changes that I've made in the past couple of years, like switching to glass for everything that I use instead of plastic.
Yeah.
I got rid of my uh, air diffuser. Like I have a diffuser because it was one of those water ones with essential oils. So
Uh-huh.
now I have one that's just essential oil because it
Got
was
it.
creating mold.
Oh, yeah,
So
yeah.
there's a lot of like
Just
little
diffuse it.
things that I kind of, yeah, and then you're putting
Mm-hmm.
it through the air
Yeah,
and you're
totally.
breathing
Yeah,
it
yeah.
in. So
Yeah.
there's a lot of little things that I'm just picking up on. And it's like, you don't have to
Mm-hmm.
go and be like, a ridiculous health freak. And,
Sure.
like I'll still drink on like every now and then with my
Mm-hmm.
buddies. Like I still live a balanced life. And I think that's what's
Sure.
important. Like if
Yeah.
you go too extreme, I think that's a stressor too,
For sure.
because you're
I
not
admit
enjoying it.
I'm so much like you. I agree in so many ways. It's not because there are things that I've changed. I'm 42 now, and I've noticed that I do have a lessened ability to regenerate and heal than when I was like 25. I can still do a lot of the physical things I used to be able to do,
Just
but
takes a little bit longer to recover.
yeah, I'm just a
Yeah.
little more health conscious. It's not like I've gone too crazy like you. Once in a while, I'll have a beer if I'm out with people. I drink less than I did when I was 25.
Yeah.
I'm a little more, I've always been pretty disciplined about sleep, but I've got like one of these mattress things that circulates cool water and it really
Oh,
helps me
cool.
sleep better. Like, I love
Cool.
that thing. Similar to you, I try not to use a lot of plastic type things when I'm cooking or eating out of things. I try to mostly use glass. And I have two kids, so I'm thinking about this in terms of their health as well. And I love, I think sometimes for patients, what you were talking about before, maybe one of like the foundational principles, like you said, is everything can be a stress or can take away some of that stress and be an anti-stressor. And just think about that in your life. Like, what are the psychological stressors? What are the physical stressors? Like, what does that balance sheet look like? And how can I get things dialed back in a little bit? And I think it's interesting, nowadays, a lot of times our modern culture, I don't know if you've ever read the book Comfort Crisis, but it talks a lot about how life has gotten so easy. And with technology,
Mm-hmm.
we've removed a lot of the old stressors that used to be good for our body, like thermal. Like we used to be out in the heat, or like I grew in Montana, Toronto. Like
Such a good
there's
point.
like that's why
So now
everybody's into cold
temperature
plunge.
is a stressor
Yeah.
for people
Like
because their body can't regulate.
exactly. So now it's like people are using cold plunge and sauna. It's like, and we're having to reintroduce these things that used to be a part of normal life. Now we live in AC and heaters and we always in the same temperature. We don't, our
Exactly.
body, I think sometimes our bodies, maybe an easy way to think about it is what capacities does your body have? And
Exactly.
are you working on training those capacities? And if you're not, then maybe that's just something you need to think about in this more comprehensive kind of treatment plan.
Exactly. And knowing your like where you're at too. Like
Hmm.
people will watch like workout videos online and I'm seeing a lot of like these high rocks videos, which is like a high intensity kind of workout. And the person that it's super stressed, I don't think that's a good workout program for them. But they're seeing someone do it and it looks cool and they want to do that. So now they're like doing this like really high intensity workout and their body's already in a fight or flight state.
Sure.
You're not even going to build proper muscle mass and stuff because like
Yeah.
these processes don't work the same way. Like that
Yeah.
regenerates and rebuilds when we're resting and digesting.
Yes.
So
It's
it's
like that
all
person needs
connected.
like more of the parasympathetic, like something at least in the beginning that's maybe more of like a yoga that helps encourage that. Or maybe
And
they
that's where all of
do
these practices come into play.
totally.
It's like those are all just means. It's kind of like what you said. Those are kind of natural things that we should have in our day to day. But now we've
Exactly.
kind of reintroduced it because
Hmm.
our life is just go, 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 go.
Yeah.
And the availability of food and like how much food you want and it's a lot of it's processed. You don't have to hunt your food and
Yes.
like we're a long ways away from like when that was the thing. But
Mm.
like even having your own farm and growing your own food, like you'd have to exert a certain amount of energy to crop your foods to eat it. Now
Yep.
it's like you drive in your car, use no energy, walk inside. And now a lot of people are just ordering food to their place. They're not even
Yeah.
leaving.
Yeah,
So
totally.
like things are getting a lot different. Like now bikes are motorized and you have
Yeah.
electric scooters and you have all of these things that people don't even need to move their body to get from place A to place B.
Mm-hmm.
So like life is going this way. Our health needs life to kind of go this way. We're
Yes.
starting to reintroduce things, to kind of
Yes.
bring the path back. But there's too many things going this way that that's why
Yep.
like this dysregulation is just getting worse and worse and worse.
Yep.
And
I
I
think
think,
people, yeah. Go ahead. Sorry.
sorry, I was just gonna say, and I think like if I was to kind of create, a program or a book or a course or something, like it would be all integrated around kind of this whole topic that we've had of like,
Mm-hmm.
what affects the nervous system, how can we improve it, and identifying different symptoms that might be associated with it. And I think it's one of the most important things to learn, especially with like anxiety and depression levels rising more than ever too. Like I
Yeah.
think that's a really big factor for mental health.
Yeah. I agree. I think this is such, I think this last discussion is such a good ending point for where we're at, 'cause I think it's been such a good summary. And I agree with you. I think there are all these different stressors that have come about that I think a lot of them are driven by technology and sort of like hustle culture and the pressures that are on people in modern society. And I think a lot of it we haven't caught up with. Like we are ultimately hunter gatherers. Like we came from that. And I think sometimes that's a great way to like, what did hunter gatherers do? Well, they went out and like foraged and they picked, like they ate whole foods, like from the earth. They moved a lot. They weren't,
A lot of
because
sunlight.
yeah, like exercise and movement is a physical stressor, but it's one that's really helpful to our system in the right dosage at the right time, what we're
Exactly.
ready for. And most of the physical stressors that people encounter nowadays are related to being sedentary and static,
Hmm.
and they're not moving their tissues. And I think sometimes just think back to like, where did we come from as humans and what have we evolved to be like? And our world nowadays is so different from where we came from. And
Hmm.
it can seem so complicated, but I think in some ways it doesn't have to be. And like you said, you can give people hope by just
Exactly.
giving them some simple strategies to start implementing and thinking about to kind of rebalance that kind of stressor sheet. And so, man, I love this was so awesome. Like to hear where you are, how you approach patients, and kind of hear more about osteopathy and just that approach. I think I knew a little bit about it, having had some experience, but I think for other practitioners out there and for patients, this will be so helpful for them to hear. Because I mean, to be honest, like even though I knew a little bit about osteopathy, I didn't know that much.
Did
You
you like
know,
did you get a good idea after today?
oh
Like
no,
did
I
it
think
help a
this
little
is
bit? Yeah.
totally. I think this is super helpful. I think the one section where you kind of laid out like the anatomy, like the structure, function, and then thinking about all the different systems and just going into it with that mindset of like not leaving one part out of the body out, and just
Hmm.
realizing that all of these different, if you're going to see a musculoskeletal provider for pain or an injury, well, you also should be considering. I think that's where we all should be moving as healthcare practitioners. It is this more holistic perspective where we're thinking about all the systems in the body, all the different variables that can impact a human. Like the human experience is a complicated one, and you can't be
Hmm.
so narrow-minded and just myopic and just looking at one system, one thing, treat these symptoms, because to get to the root cause of something, you have to peel back all the layers and think about
Hmm.
all the factors that could go into that person's experience. And so I thought the way you laid it out was really helpful, and I think anybody listening to this, I think it'll be cool because it gives people actually more options. I often encourage patients here sometimes who have been in kind of the traditional medical system to go see a DO, because I know DOs will offer a different perspective sometimes.
Different
And so
perspective. Yeah.
yeah, so I actually thought about that was the first thing I thought about out of undergrad was going to be a DO, and
Interesting.
so um, yeah, I think it's really helpful. A lot of the way you think is how I've kind of transitioned over time. I luckily came, my mom's a psychiatric nurse practitioner, my dad's a
Oh,
social
cool.
worker. I came from a household and I was an athlete like you. So I came in with a lot of kinesiology stuff to being a physio. And so I feel lucky in that background helped me, I think, be a little more holistic and think
Hmm.
about kind of the whole person. Whereas I think a lot of practitioners they didn't have that kind of background, or their education was very just focused in one system or area of the body. And I think conversations like this will help patients and practitioners just be a little more global in their how they
Hmm.
think about how they're feeling and how they're functioning. So, man, I thanks, Brendon. Thanks for what. Anything else you want to add, or where can we find you? Like anything else you want to talk
Yeah.
about?
Socials are BT Osteopathy. So Instagram has a dot, but you'll find it either way.
Yep. Yep.
Yeah, it's been great. I want to just bring up one last point,
Yeah. Totally.
just
Yeah.
for like more of your understanding of things.
Yeah.
Um, yeah, so like if you assess a patient, you notice
Mm.
that like it's a musculoskeletal lesion,
Yeah.
then you're working with like the muscles in the joints, like in and around that area that influence that area. That's kind of pretty well understood.
Mm.
But let's say someone comes in with like um, edema or swelling, and you know that the lymphatic system and the venous system is kind of the main priority. The treatment consists of following that pathway.
Mm.
So, like if it's in the foot, working the ankle, behind the knee, the hip, the groin, the diaphragm, kind of working those main lymphatic drainage areas so that you're
Yeah.
kind of following the pathway back to the heart. If it's blood supply, then you do the inverse, right? Like you're kind of like maybe this area is freezing cold and it's not getting proper blood supply. Well, now
Yeah.
you're trying to find like sometimes the veins go a little bit of a different way than the artery, so now you just
Mm.
have to make sure you follow the artery. So
Mm.
it's a very logical approach.
Yeah.
It just comes down to like being able to identify what the issue is. I think that's like the hardest part.
Yeah.
But like once you get good at that, figuring out what to do to fix it is or to help it improve. I don't want to use to fix it, but that becomes a lot easier because like
Mm-hmm.
it's like if someone came in your house and they're a contractor and they do drywall and painting and electricity and hydro and whatever plumbing, and you have an issue, like let's say you have a water leak, they're not going to go look at your electrical system.
Yeah. Yeah. Yeah.
Why
Yeah.
not? Because
Mm-hmm.
it's kind of obvious. It's like, well, it's obviously a pipe.
Mm.
So it's like if you're treating someone and they have a certain issue, well, it should be obvious what system you're kind of trying to influence based on what they're experiencing. So it's like once you kind of understand that, it just makes things a
Yeah.
lot simpler.
Yeah. The house analogy is a great one too, because it all boils down to anatomy, like you said
Right.
before, right? Like if you have an electrical issue in your house, well, the electrician would trace those wires all the way back to their
To
source.
figure out what part of that is the problem.
Exactly.
Could be the
Where
light
in
bulb
that,
or it could be anywhere
somewhere
along
along
the
the
cord.
line.
Yeah.
Exactly. So
So
the
that's what a lot of
same
patients
thing.
don't get when you work away from
Yes.
an area.
Yes.
They're
They're like,
like,
why are
my
you doing
pain's
this?
here. Yeah, yeah.
Totally. But it makes sense here. It's like you realize why you have to explain anatomy to patients
Yeah.
because yeah,
You
you've
can't
got
you
a
can't
venous.
expect them to know. Like they didn't go to the schooling for it. So like,
Yeah.
when someone says that, I'm like, look, like, and I try to have a lot of diagrams around and I use like
Mm-hmm.
the complete anatomy app quite a bit.
Yeah. Yep.
So I'll just like pull it up and I'll show them. I'm like, look, this is the
Yeah.
pathway. This is why we're working on, the space between the collarbone and the rib because all the brachial plexus goes in there. And they're like, oh, like I didn't know it was like that. And you
Yeah.
explain if the rib is elevated, like why that space kind of closes. So
Yep.
it's then they're
It
like, oh,
really is
okay, that
helpful
makes a lot of sense
for sure. Yeah.
because
When
it is
people have that
logical.
visual kind of like they can see it, like what's going on inside the body. Because most people haven't taken anatomy. They have no idea
They
how
have no
complex
idea.
things are underneath the skin, like
Most people
underneath the
don't
muscle.
even know you have ribs up here.
Exactly. Whenever I tell
They're
people, I'm
like,
like,
my
well,
ribs are
your
up
first
there.
rib starts here. They're like, what?
Yeah, yeah. They're like, I thought my ribs were down here.
Yeah, no, people are blown away. Because I show a lot of anatomy videos on my account, and I think most people have never seen a nerve. Like they don't understand like how
Interesting.
big the sciatic nerve is. Like when
Oh,
you
it's
go in and
huge.
dissect, it's huge. Like I just
Or they
think
don't realize that like a nerve is like millions of nerves connecting. Like they think
exactly.
it's like a cord or something.
Yep, yep.
It kind
Or
of
like you
is,
said
but
before, like it's its own little ecosystem. The nerve has its own microcirculation. Nerves have
yep,
their own nerves,
I
like
know. And they
that are
have their own
giving
blood supply,
exactly. So
which
it's
is
like
crazy.
there's just so much to anatomy that I think it makes you realize how good of a job, how much we have to spend time on educating on this side because when you're in it all the time like we are, you can sometimes forget how much we know,
Oh,
and
totally.
it's such a foundational element of everything we do. It's like, I mean, in some ways you might argue it is the foundation of everything we do. You have
Totally.
to
I'm sure when
understand
you
that anatomy.
exercise, you're thinking about mechanics.
Dude, I'm always thinking about like what
Yeah.
muscle
Or
am I
like,
working
I
here?
haven't really got any extension today, like
Yeah.
treating patients hunched over, like I'll just try
Got
to
to get some
like open up just
exactly.
to kind of offset it.
Yep. Anytime I travel, I'm like, dude, I've been in flexion all day. I need to
Yeah.
get some
Yeah.
lumbar extension. I need some
Yeah.
hip extension.
But that's the thing, like the simplest thing, if I have to give one line
Mm-hmm.
to sum up everything,
Yeah.
move your body in ways you normally don't.
Mm.
That's it. Because
So awesome.
because things adapt to what we do
Mm.
most. So if you
Yeah.
spend time in flexion every day, your body will adapt into that and you'll
Yeah.
lose the ability to go into extension. This is
Mm.
why people lose height as they age. But well also there's like decompression of like
Yeah.
spinal
Sure.
joints and stuff. But like, if I'm sitting there working with my head rotated this way for like 5 hours, I'm gonna, try to rotate this way for a bit and stretch it out. Now I'm not gonna do 5 hours of it. So I'm
Sure.
gonna try to like, just keep it loose.
Yep.
It's just
Yep.
you just gotta break it up. The body
Exactly.
it's not gonna adapt from one day of you being in that
Yeah.
position. You might
Yeah.
get certain muscles that kind of will stay in contraction. And now when you bring
Hmm.
your head back, you might have like a little bit of tightness, but the joint isn't going to become like
Yeah.
fully restricted from like, unless it's a deep intrinsic muscle. So there's always
Yeah, there's
nuances.
some
It's
nuance.
never
Yeah.
it's never black and white.
But it's so true. It's like everybody should just spend a little bit of time just learning the basics of kinesiology. Like, what are the movements that my joints can do, and which ones am I in
Exactly.
all the time? And I'm going to try to do some of the other ones that I don't
E-
do.
exactly. If
Right?
if people
Like,
take anything out of this podcast, that's like the main thing. And do it
yeah,
often. Like don't just do
yes,
it once. Like
yes,
these are things you need to do relative to how often you're in that other position.
yes. It's like have a mobility practice, like learn a little bit about the body. Everybody should learn some kinesiology. It's crazy that we don't teach that to everyone, that it's not
It's
a
crazy that we
forced.
go our whole life and don't even know what's inside us.
Yeah,
Well, for the most
yeah,
part.
yeah, yeah.
Like
It's
and
like
we and it just works.
totally. It is
Like it's
pretty amazing.
crazy. You
It's
don't
pretty
even need to
amazing.
tell it what to do. It just
Yeah,
works.
yeah,
And
it's
like I
crazy.
tell patients sometimes, I'm like, I'm surprised more things don't go wrong with people.
Mm-hmm.
Like if you think about how many things are actually going right, like
Oh
even just
yeah.
for us to have a conversation,
Yeah.
the amount of centers in the brain, my eyes, my lips, my tongue, all the muscles, and I'm just talking like it's nothing.
Oh,
Like it's
it's
just
unbelievable. Every time I've done a human dissection and I've looked at like the bowels, I'm like, these
it's
brown tubes are doing
crazy.
all this amazing stuff my whole life, and I'm not having to think about it. Like you look at it and you're like, the guts sometimes are very like not impressive, and you're like, they're so complicated in their physiology, but when you look at them, you're like, I can't believe that this thing works my whole life, and I
It's
don't have to
insane.
think about it,
Same
and
with
it's
the
just,
heart.
yeah,
Well, all the
it's
organs. Like
unbelievable.
it's
Yeah,
crazy.
it's
Have you ever
amazing.
held a brain?
I have, yeah, yeah.
They're
It's
so
yeah, it's
soft.
yeah,
Oh my God.
it's
Like if you like literally just push a little, like you'll go like
yeah.
right through it. It was
Oh yeah, you
crazy.
feel like you're gonna damage it.
Yeah. Yeah.
Yeah. Well, Brendan, thank you so much, man. This was amazing. We could just keep talking for hours. It'd be fun to do. I know we've talked about at some point doing an in-person episode, like recording, collaborating on some content. I'd love to. It's so fun to just meet people too, because my wife always makes fun of me. She's like, "They're not your real fans. You just know them on Instagram." But so it's great to like actually meet someone and just kind of get to hear their voice and hear how they think. So I appreciate you so much for coming on the episode. Looking forward to doing more in the future, and just thanks again.
Yeah. Thanks for having me. It was fun. Love
All
talking
right, see
about
you,
this
man.
stuff. Have a good
Yeah,
one.
same here. See you, buddy.
Bye.
Bye.